A new Medicare model, Wiser pilot in 6 states. What's happening? Beginning on January 1, 2026, the Centers for Medicare and Medicaid Services, CMS, will initiate a pilot program known as Wasteful and Inappropriate Service Reduction, Wiser, across 6 designated states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. This initiative will implement prior authorization requirements for 17 categories of outpatient procedures identified as high risk for unnecessary expenditures or low clinical value. Why these states? CMS has likely chosen these states due to the existing coverage policies established by their Medicare administrative contractors for the services in question, facilitating a smoother implementation process. Moreover, these areas exhibit poor performance on metrics related to avoidable costs and utilization, indicating that a successful reduction of inappropriate services could result in substantial advantages. What services require prior authorization? Examples include, but are not limited to, nerve stimulators, e.g., electrical, sacral, vagus; deep brain stimulation for Parkinson's disease; epidural steroid injections; vertebral augmentation, PVA, for compression fractures; knee arthroscopy and lavage; cervical spinal fusion; skin and tissue substitutes. The role of AI and human oversight. The pilot program intends to utilize artificial intelligence, AI, to expedite authorization decisions, with licensed clinicians retaining the authority to make the final determination. Goals and concerns. Benefits. Minimize wasteful or clinically questionable services. Reduce Medicare expenditures for these specific services. Promote a shift towards more evidence-based care delivery. Risks. Increased prior authorization demands on healthcare providers and patients. Possible delays or denials of essential care. Financial incentives for reviewers to deny services, raising concerns about bias. Uncertainty regarding the precision and equity of AI-assisted decisions. Timeline and scalability. The pilot will operate from 2026 to 2031, divided into 2 3-year phases. Based on the results, CMS may consider extending Wiser to more states, services, or technology contractors. Patients, original Medicare in pilot states. Patients may experience new delays due to pre-authorization requirements, yet they could potentially avoid receiving services of low value. Their existing rights to appeal remain unchanged. Healthcare providers. Healthcare providers are required to submit authorizations for certain procedures. As they encounter increased paperwork, they may experience slower workflows. CMS and taxpayers. There are potential financial savings and a decrease in the misuse of services. However, it is essential to monitor for any negative patient outcomes or reduced access to care. Policy watchers and advocates. It is imperative for policy watchers and advocates to closely observe the performance of AI tools, the rates of denial, the clinical implications, and whether patients continue to receive timely care. Looking ahead. Focus on outcomes. Will Wiser effectively reduce waste without jeopardizing the quality of care? The outcomes will determine if CMS will expand this model further. Monitoring is crucial. The transparency regarding denial rates, processing speed, and patient experiences will be key in assessing the fairness and viability of the pilot program. Adaptation possible. Based on feedback and initial outcomes, CMS may adjust processes, modify covered services, expand the rollout, or change technology partners.